The respiratory system is responsible for the exchange of oxygen and carbon dioxide in the body. It includes the nose, mouth, throat, larynx, trachea, bronchi, and lungs. The main functions of the respiratory system include 1. Breathing. The respiratory system allows for the intake of oxygen-rich air, inhalation, and the release of carbon dioxide-rich air, exhalation, through the process of breathing, also known as respiration. 2. Oxygenation. The respiratory system facilitates the transfer of oxygen from the air we breathe into the bloodstream, where it is transported to cells throughout the body to support various physiological processes. 3. Removal of carbon dioxide. The respiratory system removes carbon dioxide, a waste product of cellular metabolism, from the body by exhaling it out of the lungs. Factors that can damage the respiratory system include 1. Smoking. Smoking, including both active smoking and exposure to secondhand smoke, is a major risk factor for respiratory diseases such as lung cancer, chronic obstructive pulmonary disease, COPD, and respiratory infections. 2. Air pollution. Exposure to indoor and outdoor air pollution, such as smoke, dust, chemicals, and other airborne irritants, can damage the respiratory system and increase the risk of respiratory diseases. 3. Respiratory infections. Infections caused by viruses, bacteria, or other pathogens can damage the respiratory system and lead to conditions such as pneumonia, bronchitis, and respiratory distress syndrome. 4. Occupational hazards. Exposure to occupational hazards such as asbestos, silica, and other harmful substances in the workplace can damage the respiratory system and lead to occupational lung diseases. 5. Allergens. Exposure to allergens such as pollen, pet dander, mold, and dust mites can trigger respiratory allergies, asthma, and other respiratory conditions. To protect the respiratory system, it is important to 1. Avoid smoking and secondhand smoke. Quitting smoking and avoiding exposure to secondhand smoke is the most important step in protecting the respiratory system and preventing respiratory diseases. 2. Reduce exposure to air pollution. Minimize exposure to indoor and outdoor air pollution by using air purifiers, avoiding smoking indoors, and reducing the use of chemicals and other pollutants in your environment. 3. Practice good respiratory hygiene. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing to prevent the spread of respiratory infections. 4. Practice good hand hygiene. Wash your hands frequently with soap and water, especially before touching your face or handling food, to prevent the spread of respiratory infections. 5. Avoid allergens. Identify and avoid allergens that trigger respiratory allergies or asthma, and take steps to reduce exposure to them, such as using air purifiers, keeping your home clean and well ventilated, and avoiding outdoor triggers when possible. 6. Wear protective gear. If you work in an occupation that exposes you to respiratory hazards, such as dust, chemicals, or fumes, make sure to use appropriate protective gear, such as masks, respirators, and ventilation systems, to minimize exposure. 7. Seek timely medical care. If you experience respiratory symptoms such as persistent cough, difficulty breathing, chest pain, or wheezing, seek medical attention promptly to detect and manage any potential respiratory issues early. As always, it's best to consult with a qualified healthcare professional for personalized advice on protecting and maintaining the health of your respiratory system, particularly if you have any existing health conditions or concerns.